In this video, here's what we'll cover. 2 systems that should take turns. The loop that feeds itself. What anxiety-driven sleeplessness looks like. What does not work. And why. What actually works. CBT-I. It is 3:14 in the morning. You have been in bed for hours, and awake for most of them. Your mind has run through tomorrow's meeting twice, an awkward conversation once, and the bills again and again. The alarm is set for 6:30. You do the sums again, and the sums only make it worse. If you know this hour, you are not alone, and there is nothing wrong with you. Anxiety and sleep have a relationship we describe as bidirectional. That is a clinical word for a simple, cruel idea. Anxiety wrecks sleep. Poor sleep worsens anxiety, and each night the loop pulls a little tighter. Here is the good news. This loop is one of the most treatable patterns I see in my practice. The tools that break it do not run on willpower, but on a specific, evidence-based approach that I will walk you through. Let me start with what is happening at night. Sleep is not simply the absence of being awake. It is an active state, and it depends on a handover between 2 systems. One is your alertness system, which responds to threat and keeps you switched on. The other is your recovery system, which slows your heart, quietens your mind, and lets sleep in. For sleep to arrive, the alertness system needs to power down so the recovery system can take over. Anxiety keeps that alertness system running, often quite subtly. Just a mind that will not stop planning and a body that never quite settles. We call this hyperarousal. It comes in 2 forms: physical tension, and the more important mental kind. A mind that keeps scanning and rehearsing when it should be winding down. It is what people mean when they say their body is exhausted, but their brain will not stop. For a long time, we thought of insomnia as just a symptom of anxiety. Fix the anxiety, the thinking went, and sleep would follow. In the last 20 years, that view has flipped. A large review of long-term studies found that insomnia actually doubles the risk of developing depression later, and raises the risk of anxiety disorders too. A landmark trial from around 2017 went further. Nearly 4,000 students with sleep problems were given either an online sleep program or their usual care, and improving their sleep is far more than their nights, reducing anxiety and low mood as well. A later review of 65 trials found the same pattern. So sleep is not only following distress, it helps to drive it. And that means one treatment, aimed at sleep, can help with both at once. Not every sleep problem comes from anxiety, but the anxious kind has a recognizable shape. There is trouble falling asleep as the busy mind runs, waking in the small hours when worry latches on, and sleep that looks long enough on paper but leaves you tired. There is dread of bedtime, and a preoccupation with how badly last night went. Nightmares are common too, especially with heavy anxiety and with PTSD. And they can be treated. If sleepwalking or night terrors are frequent, an assessment from a sleep doctor is important. First, a short list of what does not work, because the anxious mind reaches for these. Trying harder to sleep backfires, because effort switches the alertness system straight back on. Long-term sleeping pills are not the answer, and guidelines here and overseas advise against them for ongoing use. Alcohol may help you drop off, but it fragments the second half of the night and leaves you more anxious the next day. Chasing a perfect sleep score only feeds the worry, and long daytime naps steal the sleep pressure your body needs for the coming night. So what does work? The first-line treatment for ongoing insomnia is a structured therapy called CBT-I, cognitive behavioral therapy for insomnia. It usually runs over 6 to 8 sessions. We start with education and a sleep diary, mapping what is really happening, which is often different from how it feels. Then comes stimulus control, where the bed is for sleep only. If you're awake for more than about 20 minutes, you get up, sit in low light, and return when sleepy, which rebuilds the link between bed and sleep. Next is a careful, temporary trimming of time in bed, which sounds harsh but builds sleep pressure and knits broken sleep together. Then we work on the catastrophic thoughts, the "if I do not sleep I will ruin everything," which quietens that mental hyperarousal. And finally, gentle wind down and relaxation skills. Most people notice real gains within 3 to 4 weeks. Alongside CBT-I, treating the anxiety directly matters, And here CBT and ACT have strong support. Where the anxiety has a trauma root, EMDR can ease the nighttime reactivity that keeps sleep broken. A few simple steps help while you wait for that first appointment. Keep the same wake time every day, weekends included, and get outside in daylight soon after waking. Keep the phone out of the bedroom and keep a short sleep diary for a couple of weeks, which makes the first session more useful. If the nights are hard right now, please know this pattern responds well to the right help, and you do not have to untangle it alone. At Potentialz Unlimited in Bella Vista, we support people across the Hills District with CBT-I and evidence-based anxiety treatment. You can read the full guide, or book an appointment, using the links below. And if worry ever brings thoughts of not wanting to be here, please reach out now to Lifeline on 13 11 14, or in an emergency call 000. Before you go, here's a quick recap of what we covered. 2 systems that should take turns. The loop that feeds itself. What anxiety-driven sleeplessness looks like. What does not work, and why. What actually works. CBT-I.